Um, and so that's really the cervical compressions. And another thing is with the down cutting, top shielded device, you can use it obviously to reach around other corners. For example, where's another case that we often have a difficult time reaching to the other side, reaching underneath the dura and the posterior longitudinal ligament, a TLIF. So here you can use the tool now to scrape off the subchondral cartilage and delaminating that cartilage, and thereby being able to take out the cartilage and the attached disc out. So a unique solution to prepare the end plates without big curettes and gouges to preserve the underlying subchondral bone, but yet removing the cartilage and the disc without gouging into it, and also allowing you to reach much further to the contralateral space to slowly, essentially shave off and delaminate the subchondral cartilage far beyond what you can often get with just a typical short curette or curved curette. And this is an example. Here you see the Dreal device. And then another thing is with the curettes and things like, yes, you can get the curve, but you have to keep putting the tools in and out. And often through a narrow TLIF Cambin's triangle, as you're doing that, as we're reaching in and out of Cambin's triangle, you can traumatize, obviously, the exiting nerve root. Because of that, this tool allows you to simply pass into Cambin's triangle once and then elegantly simply reach across and shave and delaminate the subchondral end plate and take out the disc and minimize the number of passes you have to do, and thereby decreasing your risk of radicular injury to the dorsal root ganglion. And that's an example of the Dreal 10 passes with 41 passes of curved curettes, pituitaries, so on and so forth to achieve that. And you can see you get a much more consistent, controlled, even preparation of the end plate here versus this kind of gougy pockets here, pockets there type of passes with far more risk of traumatizing the DRG with multiple passes, while ironically achieving a less thorough, less consistent end plate prep here as well. So that's a very good example of that. And here's just some cases to show that, we're not just whistling Dixie, we can actually get fusions. And there you can see the bone here and the bone there and the bone growth around the cage, meaning that the subchondral end plate and disc were removed in that area, and we can make sure that it's fully decompressed, and we can get the postoperative bony ingrowth that we all want to see. Again, nothing radically new, but just another elegant tool. While you're doing the TLIF, you can use it to decompress the contralateral frame, and you can use it to now decompress or decorticate, I should say, the cartilaginous end plates. And these are all just, again, tools that help us solve intraoperative problems. How do you work around underneath the dura to get the contralateral end plate? Well, now you have a Dreal cutting tool that you have nice controlled passages without traumatizing Cambin's triangle excessively. And you can see that here at the end of the case report. So again, part of Dr. Ashkenazi's little work, it was he looked at the cost changes of using just this suite of tools with our friends Jean-Charles Lewek and Tyler Koski. And you can see it right there that with the Dreal, it was a little bit faster because it allowed us to decorticate, and less passes equals less time. And I had overall decreased complications and readmissions for radiculopathy, radiculitis, and things like that. And you can see the overall benefit in the US and the cost reductions overall because of that. So again, this is something we've always said, minimally invasive techniques and TLIFs lead to cost savings in terms of damage to soft tissue. It leads to less infections, it leads to less blood loss, shorter operating time, shorter length of stays. And the Dreal tool is yet another tool in our armamentarium of less invasive surgery to, again, achieve additional reductions in costs and complication rate as well.